Alright, ladies and gentlemen, it's Dr.SammyG in the house. I am back, baby. I am back. So today's topic, why it's dangerous to wear contact lenses. You see, some people are shy to use glasses. They feel like they look like a nerd, so they want to try to improve their looks by using contact lenses instead. You know, I use contact lenses from time to time, and sometimes I use my glasses. It depends on where I'm at. If I'm at work, I gotta use my glasses. I gotta use my glasses so that the patients think I look like a nerd, and hence they have a better understanding and they feel more safe when it comes to meeting me. But when I'm with my guys or meeting some chicks, I'm using my contact lenses instead, just because I gotta look a bit cool, dangerous, like a dominant alpha male, you know what I mean? So it all depends on my situations. However, it's not actually beneficial to use contact lenses 24/7, and there are some possible complications when you use contact lenses frequently. And why is it dangerous to use contact lenses? What is the cause and what are the complications? Well, here's the thing. There is a specific diagnosis when it comes to the eye, which is called keratitis. Now, keratitis means you have an infection or an inflammation in the cornea. What is cornea? I would say like this. You can call cornea like the transparent shield that is covering the colored eye. As you can see in this picture, cornea is pretty much the dome that is acting like a shield around the colored eye. Now, that shield can be infected. It can be infected due to different types of reasons. And one of the main reasons is the use of contact lenses. And the reason for that is because if you have bad hygiene and you don't take care of your contact lenses very carefully and very properly, there is a high risk of your contact lenses getting contaminated. And as they get contaminated, what happens is they become infected with different type of microorganisms. Bacteria, fungi, other type of eukaryotic microorganisms, and even viruses. So consequently, you can get different type of infections in the cornea resulting in keratitis. You can get a bacterial keratitis due to a contaminated lens, which is infecting the cornea and thereby creating this problem. You can also have, due to bad hygiene of yourself and even contaminated lenses, causing a fungal keratitis. And sometimes, if you are contaminating these contact lenses with contaminated water, or in the swimming pool, for example, or even hot tubs, you can get a microorganism called acanthamoeba keratitis, which is pretty much a eukaryotic microorganisms that can also infect the cornea, and that is also very dangerous. And aside from causing infections in the cornea due to contaminated lenses and bad hygiene, you can also cause keratitis due to the fact of you are causing mechanical irritation of the cornea. And that means you might be using some contact lenses which is not fitted properly in the cornea, and thereby causing some type of abrasions in the cornea, and hence it becomes infected. And apart from that, frequently used contact lenses can cause lack of oxygen in the cornea, and thereby preventing the cornea to function as it's supposed to. And if there's lack of oxygen, it can actually damage the capacity and the defense potential of the cornea, causing it to be susceptible to infections, and therefore causing keratitis. Now, does that mean you're not supposed to use contact lenses? Absolutely not. I use it from time to time, like I said. It all depends on the situations. If I'm with my boys or meeting chicks, I use my contact lenses. If I'm at work, I use my glasses. It all depends on the situation, man. I gotta act like a fox, you know what I mean? But aside from that, how can you prevent the contact lenses of getting contaminated and causing keratitis? First of all, man, you gotta wash your hands before you use your contact lenses. That's the first thing. Second of all, you gotta use some fresh, clean, lens sterile solution instead of using tap water when it comes to cleaning these contact lenses. Furthermore, you gotta replace lenses and storage cases regularly. So maybe once a month. It all depends on the type of contact lenses you're using. Sometimes you gotta change it every day, while others you're able to change it once a month. And also, try to avoid using contact lenses frequently and also overusing during the night, due to the fact that the cornea is getting less oxygen and thereby it cannot function as it's supposed to do. And last but not least, try to use the right type of size of lenses when putting them so that it can fit properly around the cornea. Otherwise, there is a risk of contaminating the cornea and causing infection and also causing mechanical irritation of the cornea. Now, the reason for why keratitis is dangerous is because of the complications that can take place after the infection. You can actually lose your eyesight. You can get something called astigmatism, meaning that you can get a blurred vision due to the cornea getting damaged, which can require surgery. But you can also get a central scar around the cornea, causing your vision to be damaged permanently. And that is very dangerous. You need those eyes, man. You got to protect those eyes. And last but not least, this is also a very serious complication. One of the typical bacteria that causing keratitis is called Pseudomonas. Now, Pseudomonas is a very dangerous bacteria, especially when it comes to infecting the cornea. If Pseudomonas infection can actually cause a very aggressive infection of the cornea, causing the cornea to melt. And if that causes it to melt, it can actually lead to a perforation and also something called endophthalmitis. These are very serious conditions where an eye doctor really need to be consulted and also take care of the patients once that patient reaches that stage. But most of the keratitis are taken care of by the eye doctors. Usually when these people come to the family doctor like me, once I suspect they have keratitis, they need to immediately be taken care of eye doctors, or in other words, the ophthalmologist. So it's a very serious condition, especially when it comes to use of contact lenses, because most of the people that have keratitis are usually correlated with the contaminated use of contact lenses, and also frequently using contact lenses causing irritation and damage to the cornea and thereby leading to keratitis. So now you understand why contact lenses can be dangerous for the eye and the type of complications that can take place when it comes to keratitis. I hope you guys have a great day and take care. Peace out, baby.